Hi, my name is Kayla Buckles and I'm going to be performing perineal care. I'm first going to show you exactly what I'm working with, that way you know exactly what I'm going to be doing. I'm doing this the best I can, but we're going to roll with it. Just turn this around. First, I'm going to knock hand hygiene. Hi, my name is Kayla Buckles. I'm going to be your student nurse today. I'm going to be performing perineal care on you. Would that be okay? Yes, okay. Can you please verify your name and date of birth for me? Mr. Bear, date of birth 1/10/96. Okay, perfect. So now I'm just going to go ahead. I'm going to ask you to just lift up your legs for me after I put my gloves on. Let's see. Perfect. Got these babies on. So now I'm just going to go ahead and what I'm going to do is I'm going to perform the perineal care, but I have a little bath blanket right here. So what we're going to do is we're going to lift your blanket up and then we're going to put the bath blanket over. Is that okay? Yes, okay. So first I'm just going to take your sheets from underneath because you are wearing a gown. So I'm just going to drop those to the side. Down here I'm going to lift up your blanket, and since your gown is right here, we're going to go ahead and just put this bath blanket over you. That way it makes you feel a little bit more comfortable. I'm just going to lift this up to a comfortable level for me. All right, and I'm just going to ask you to bend your legs up. Perfect. Well, y'all can't see it that way. All right, so now what I'm going to do is I'm going to detach your catheter. And since you already have a waterproof pad underneath you, we don't have to put a new one under there. But if it does get soiled or anything like that, we'll change it out. But since this is underneath, I'm going to just go ahead and lay the catheter right here. And what I'm going to do is wet my washcloth in my basin of water and soap. And I'm just going to fold it to where it's like a mitt around me. And I'm just going to spread the labia. I'm just going to wipe from top to bottom, right? I'm going to flip and do the other side, top to bottom, inner to outer, right? Spread open again, top to bottom. And do it again, top to bottom, in to out, right? And then for last, I will just hold the tip of your catheter and go down at least 4 inches. Okay. Soiled linens. Then I'm going to get my new cloth and I'm going to rinse. So again, top to bottom. And we got the labia spread the whole time, so we'll go on this side, top to bottom. And do it again. Inner to outer. Inner to outer. And then we're just going to rinse your catheter at least 4 inches down. Soiled linens. And now I'm going to take my new one and we're just going to spread the labia again and we're just going to pat dry. Pat dry. Pat dry, and pat dry. And then we're just going to take this last bit and we're just going to pat dry as well for the catheter. Okay, soiled linens. Now we're going to go ahead and just attach the catheter back. Sorry, give me 1 second, it's not attaching. Okay, and now we're going to deglove, wash my hands, okay, and we're just going to put, deglove, wash my hands, and we're going to put new gloves on. And now I'm going to go ahead and just unfold this bath blanket back down. And again, if this is soiled, we would take this and remove this. But since it's not soiled, then we won't do anything with it. Take the bath blanket down, and we're going to pull the rest of Mr. Bear's gown all the way up. to where he is fully clothed. And when we put his blanket back over, we're going to take the bath blanket from underneath to where he's not being exposed at all. Okay, soiled linens, deglove, and wash my hands. Bed in the lowest position, and then Mr. Bear will get his call bell. Do you have any questions for me, Mr. Bear? No? Okay, well, thank you. And that is how you perform perineal care.